So in previous class, we talked about dilutions, how many methods of dilutions are there, which are the correct dilutions we studied. The practical demonstration also is there, but we will discuss we will do later on. Okay. Today we are going to talk about an important topic that is about doses. Okay. Because after selection of a remedy, after giving correct dilution, after taking uh, correct company medication, company remedy, so the last step is dose. If you doesn't administrate dose as needed, okay, so we doesn't get the proper, we don't get proper results. Okay, so let's talk about the doses. So basically, we have one is the dose, how to take the dose. One is nature of dose. Nature of dose. Sorry, here I have to write dose. One is nature of dose, and one is quantity of dose. Quantity of dose. And another one is also is there administration of dose. How we will take by means of orally application, by taking ointment, by making pills or drops, anything. Okay. But here only we'll talk about nature of dose, and another one is quantity of dose. So basically, quantity of dose means how much drops you have to give. So it is purely depend upon the age. Quantity depend upon age. Depends upon age. Okay. Quantity purely depend upon age. If the baby from 1 day baby to 1 year will give one drop. Okay, one drops. One drop. From 1 year to 2 years, two drops. 3 years to 4 years, three drops. 4 to 5 years, four drops. 5 to 6 years, five drops. 6 to 7 years, six drops. Till 10 years, we have to give 10 drops. After 10 years to till 60 or 65, we have to administrate 10 to 15, in some cases 15 to 25. Because the growth, the vertical growth, or everything, the growth will be stopped from here, and with the hormonal changes will start mainly from after 10 12 years, female or male. Everything is hormonalized. Okay, the growth of the body, the growth of the internal organs, the growth of the secondary sexual characters is purely depend upon glands or hormones. So that's the reason here we uh, stopped the dosage till 10 years. After 10 years, we can administrate 10 to 15 drops, or depending upon the condition, 15 to 25 drops also can be taken. So I think you understood quantity of dose. Okay. If what if someone give two drops instead of one drop, three drops instead of four drops, so what will happen? I think so nothing will happen. Something he maybe get sweating. It may be the heart rate maybe increases. So for some time, respiratory rate maybe increases for some time. So you have to do what you have to do. You have to give the water to advise the patient who was the guardian or father or mother, you have to advise water to give him water, half glass water. Then everything will be settled down. Okay, don't worry about the anything happen to the baby or the boy or the girl or child. Okay, so here now very important is nature of dose. This is very important. You have to remember nature of dose. Nature of dose is purely depend upon. So what are the types of nature of dose? We have the stronger dose. We have lighter dose. Other than this, there is no other dose system. Okay. We have uh, lighter dilution. Okay. We'll talk about that. But we doesn't have stronger dilution. Here we have stronger dose and we have lighter dose, but we doesn't have other than this. What is the stronger dose? What is the lighter dose? So basically, whenever any disease happen, it may be acute, it may be subacute, it may be chronic. If the any disease, if the activity or the functions of the organ, it may be hyper. In the acute, the organs all have organs because due to the organ dysfunctions, equilibrium of blood and lymph, the differentiate the organs will have uh, the problem due to the lymph and blood. So organ will what happen? It will show the effect due to the disharmony, due to the disequilibrium of blood and lymph. So wherever the blood and lymph affected more, so that organ will show off some signs. Okay, the organs will show some signs. Okay, if those signs are hyper or maybe hypo. Okay, we have acute disease, we have subacute disease, we have chronic disease due to the disequilibrium of blood and lymph. So which part of the lymph and blood affected, that organ shows some signs, some symptoms also. Okay. So the signs, mostly signs, if they are in hyper mode or hypo mode, depending upon the hyper and hypo function. Okay. Hyper and hypo function, we decide the dosage. Okay. If there is hypo or hypofunction or hypoactivity, we will give stronger dose. We will give stronger dose. So the dosage will for hypofunction or hypoactivity, that is stronger dose. Because here we have to improve this hypoactivity. That's the reason we are giving stronger dose. How to administrate the stronger dose? Stronger dose we have to take in directly on the tongue. Okay. Well, this is remedy. So I make remedy. It may be D4, it may be D5, it may be D6. So how to take? You have to administer that remedy on the tongue, like okay. So stronger dose. Next, we have hyperactivity or hyperfunction. Okay, we have to administrate the lighter dose. Lighter dose is purely depend upon hyperfunction. So we have to add in water. Quantity of water, it may be added like is half glass of water required according to the hyper function. So we have to give the water in, we have to add that medicine D4, D5, D6 in half glass water. Okay, and you have to advise to drink the remedy sip by sip. Okay, so this is the dosage we have to select. Basically, with example, we will understood this thing very easily. Like one patient came to your clinic. Okay, he had fever. Okay, we have to check some parameters whenever a patient coming, like BP, pulse rate, okay, respiratory rate, and temperature. So basically, in fever, temperature is arised. That is 102. So we are selecting a remedy F1, A3, and YE. So because this is the acute condition, so which dilution we have to take? We have to take D6. Okay. Now we selected the remedy. Now we make the dilution. Next is dosage part. So we have two patients. Okay. One patient had fever 102, but he is cool, not anything happening. Okay. Or else 102 degrees Fahrenheit. He have weakness with fever. Okay. And he have giddiness, vertigo. Okay. And his pulse rate is low, below 60, less than 60, and his respiratory rate is low, below 15. Okay. BP is also low, 90 by 60. So now with that fever, he have hypofunction of the body seen because of all this are in low activity. So what type of dose we have to give? We have to stronger dose. What type of dose we have to give? We have to give stronger dose. Okay. So this person, the F1A3YE, which remedy is selected in D6, we have to give directly on the tongue. Directly on the tongue. Okay. Then this one patient is cleared, so we selected stronger dose. Another patient, same 102 fever is there. He has sweating, more sweating. He has vomiting. Okay. He has pulse rate high, greater than 80, respiratory rate greater than 20, BP more than BP 130 by 90. Okay, these symptoms, these signs shows the hyperactivity of the body of the or the organ. So what we have to select? We have to select lighter dose. Means you have to add 10 to 15 drops of D6 in half glass of water and advise the patient to take sip by sip. So in every disease, you have to select like this only. It may be stronger dose, it may be lighter dose. Then only you will get the result properly. Okay, so we talked about dilutions, we talked about dose, okay, and we talked about nature of disease. Okay, nature of disease. So, so all these are completed. Dilution, dose, nature of disease, and remaining part we have uh, different methods of dialysis also yesterday we discussed. Only practical part which remained. So we will talk, we will do the practical in coming classes. Next one thing is uh, remain, that is pulse diagnosis. So tomorrow we will plan to do pulse diagnosis. So any doubt regarding dosage or dilution, kindly ask.